In rural communities, access to adequate health care can be difficult. This month, it got harder for those living in the town of Florence, where the hospital closed down for financial reasons. Dr. Daniel Derksen oversees the Center for Rural Health at the University of Arizona and understands the challenges rural areas present for healthcare providers and patients.
Across the country, there's been 85 rural hospital closures since 2010, so we're not the only state that has had some trouble with rural hospital closures. Many of the rural hospitals, both in our state and other states, are really very close to negative margins, and so...
Financial margins.
Right, so they depend very much on Medicare and Medicaid for coverage, but also paying for their health services. And if they have to absorb a lot of uncompensated care, or what's called charity care, they often have difficulty staying open because their finances won't support their operations. In Arizona, I'd say our most vulnerable hospitals are the smaller hospitals. These are the ones with a federal designation of critical access hospital. They're the ones that are 25 beds or less, or 35 miles or more from another facility. They have to have, as part of that federal designation, a 24-hour day, 7-day-a-week emergency department. So these often form the critical infrastructure in our smallest, most rural communities in Arizona. There's 14 right now rural critical access hospitals in Arizona. There's another 2 that are in the process of obtaining federal designation for critical access hospital.
What are the health implications or the health consequences of closures on the communities that they're serving?
So if the critical access hospital closes, often it affects the pharmacy that might be in the area, it might affect the nursing home that's in the area, and any of the other ancillary services, laboratory, x-ray, other types of things that might be available for that. So people are often forced to drive longer distances or go without care.
Now, you mentioned, of course, the way Medicare and Medicaid compensate hospitals, pay hospitals. What are some of the factors that have changed that would lead to a hospital closing?
So Medicaid restoration expansion in Arizona has been the single most important factor in creating positive margins, healthier margins. But even with those changes, if Medicare, for quality reasons or other reasons, stops paying a rural hospital, often there are days cash on hand that allow them to continue operating despite the fluctuations in billing and collections. If the collections lag too long, they may not have enough days cash on hand to actually keep their doors open and keep paying their personnel.
Are there any steps that you would like to see the state of Arizona taking in order to actually improve or support rural healthcare providers more?
Well, there's probably 2 main things. One is that in health policy, at times you're forced into playing defense. And right now we're trying to sustain and build on the gains made, and there's efforts at the national level to reduce Medicaid funding. Medicaid covers about 2 million of our 7 million population in Arizona. It's critical. I think the second part is we could do a lot to make sure that our services in rural areas are strengthened. And we've done that through some pretty innovative programs in the past. Our Critical Access Hospital Pool, which is kind of our state version of the disproportionate share payments at the federal level. And that combination of DISH payments, the disproportionate share payments from the federal level, which went down as more people were covered, but also the critical access hospital pool that the state has done, those 2, I think, could be strengthened. And I guess if I would add a third one, is I think we need to make sure we have the health professionals we need in rural areas. And one of the ways that's very evidence-based is to help train health professionals during their training program in rural areas. And that has a very predictable effect on getting people to practice in those areas when they graduate, either from nurse practitioner programs or dental programs or physician programs, osteopathic or medical training programs.